This is the third pathology video, pathology 3. We're starting with genetic disorders, which are caused by mutations that are permanent alteration in DNA. The mutations may affect an entire chromosome or specific base pairs in the DNA sequencing of specific genes. The mode of inheritance could be autosomal, sex-linked, and are either dominant or recessive. Okay, let's bring the camera over here. There we go. Autosome. Any chromosome other than X or Y. Sex-linked. Linked to one sex, like Duchenne's muscular dystrophy and hemophilia in males. Autosomal dominant, having a 50% chance of inheritance if the gene is present in one parent and 100% with both parents, like sickle cell trait and adult polycystic kidney disease. Autosomal recessive, having 25% chance of inheritance if the gene is present in both parents, like sickle cell disease. Of the autosomal diseases, the following are due to chromosomal duplication or deletion. Downs is trisomy 21, which means you have an extra 21st chromosome. Mental retardation, mongoloid faces, transverse palmar crease, which is also known as the simian line, and an increased risk of developing acute leukemia and Alzheimer's. Klinefelter syndrome is XXY, so it's an extra X in tall, thin, sterile males with small testes, gynecomastia, and lower IQ. I don't know about that. Turner syndrome is XO, absent X in short females with a web neck, widely spaced nipples, small breast, streak ovaries, and typical intelligence. The following are important autosomal dominant diseases. Remember, autosomal dominant means having a 50% chance of inheritance if the gene is present in one parent or 100% with both parents. Okay, so these are the autosomal dominant diseases. Sickle cell trait, autosomal dominant, 8% of African Americans, asymptomatic unless severely stressed physically, causing hypoxia or acidosis. Adult polycystic kidney disease is multiple cysts in both kidneys, hypertension, and baryaneurysms. Marfan Syndrome, genetic defect in fibrillin 1, which is a glycoprotein found commonly in large blood vessels and in the suspensory ligaments of the lens. Tall, thin body, habitus, long spider-like fingers, arachnodactyly is the other name for that in Marfan's. Lens dislocation, ectopia lentis, mitral valve, prolapse or regurgitation, aortic incompetence, aortic aneurysm. Ehlers-Danlos syndrome, excessive elastic tissue in the skin and joint capsule, hypermobile joints leading to premature joint degeneration. Osteogenesis imperfecta, so sad. Defective type 1 collagen synthesis, broken bones, blue sclera. These are, this is tough to get the camera in the right place for this one. About there. Autosomal recessive disorders include many of the genetic metabolic disorders. Remember that autosomal recessive disorders are a 25% chance of inheritance if the gene is present in both parents. So we have glycogen storage disorders, von Gierke, G6 phosphate deficiency. Accumulates in the liver, causing hepatomegaly. McArdle, muscle phosphorylase deficiency, accumulates in the muscle, causing fatigue. Pompey, I don't know how to say that, but I'm guessing it's Pompey. Maltase deficiency affects the heart as a pump, causing heart failure. Lysosomal storage disorders. Tay-Sachs gangliosides accumulation in the brain in Ashkenazi Jews, rapidly fatal. Red macula with blindness, severe mental retardation. Gaucher glucocerebrosides accumulate in the liver and spleen. It's the most common of the lysosomal storage disorders, gaucho glucocerebrosides. Niemann-Pick sphingomyelin accumulation. Oh, I see how I read this. I read this wrong. Let's go back. Lysosomal storage disorders. Tay-Sachs is a ganglioside accumulation with a cherry red macula and blindness and severe mental retardation. Gaucher is glucocerebrosides accumulation in the liver and spleen, and it's the most common of the lysosomal storage disorders. Niemann-Pick is sphingomyelin accumulation in the liver and brain. Yeah, it's just the bolding sort of threw me off. Okay, page turn. It'll be easier when I have a stand so that I don't have to read and film at the same time and look at both things. Okay, amino acid disorders. Phenylketonuria is the accumulation of, phenylalanine due to lack of phenylalanine hydroxylase, causes mental retardation and light-colored hair. Restrict dietary phenylalanine if the Guthrie test is positive. Alkaptonuria. I don't remember hearing that one. Alkaptonuria. Deficiency in homogenistic acid breakdown. The urine turns black on standing, and it's dark, damaged cartilage, ochronosis. Metabolic. Cystic fibrosis. Autosomal recessive, causing defective chloride transport, impaired mucilary action, thick viscid secretions, recurrent infections in lung and sinuses, intestinal malabsorption, salty sweat in children. Hemopoietic sickle cell disease. Recessive gene common in African Americans, 2%. Glutamine is replaced by valine at position 6 of the beta chain in the hemoglobin. Causes microvascular occlusion triggered by hypoxia, acidosis, and fever. Painful bones with anemia, jaundice, and fatigue. Hepatosplenomegaly in children. Priapism. Sickle cell sounds rough. Commonly associated with normocytic normocromic anemia. Increased risk of Salmonella osteomyelitis. Pneumococcal pneumonia. Protect suffers from Plasmodium falciparum, which is a type of malaria. Thalassemia. More common in Mediterranean Americans. Defect in either the alpha or beta globin chains of hemoglobin A. Alpha thalassemia is more common in Southeast Asia and West Africa. Beta thalassemia is more common in Americans of Greek or Italian descent. Results in suboptimal hemoglobin synthesis. Presents with varying degrees of microcytic hypochromic anemia and fatigue. Thalassemia sufferers are also resistant to the malaria parasite. Pyruvate kinase deficiency. Inherited disorder. results in increased red blood cell breakdown, causes hemolytic anemia and jaundice. The following are important recessive sex-linked disorders, mainly males. Duchenne muscular dystrophy. Can we see this? Oh, there we go. Absence of dystrophin, progressive muscle weakness, pseudohypertrophic calf muscles infiltrated with fat and connective tissue, Gower's sign, climbing up legs in order to stand upright. Is it still filming? Sorry, we had a low battery warning. All right, we're almost done here. Becker's muscular dystrophy, milder form of Duchenne's with decreased levels of dystrophin. Hemophilia A or B is due to lack of factor 8 or factor 9, prolonged bleeding, hemarthrosis, which is bleeding into joints, Marfan Syndrome, lack of HGPRT, hypoxanthine guanine phosphoribosyl transferase. It leads to gout in children, congenital pain insensitivity, which leads to self-mutilation. Unintentional. The only dominant sex-linked disorder is vitamin D resistant rickets, aka renal rickets or renal osteodystrophy. It's a type of rickets, does not respond to vitamin D therapy due to lack of vitamin D3 receptors in the kidney. The ability of the kidney to resorb phosphate is affected, causing hypophosphatemia in the kidney. All right.